She was only 34 years old, a dedicated healthcare worker, working tirelessly to save lives at one of Singapore's busiest hospitals. And yet, in a tragic twist, she collapsed in the operating theater, reportedly due to fatigue. Just days later, she was gone. What really happened? Could this have been prevented? And more importantly, how many more healthcare workers are silently suffering under extreme workloads? Stay with us as we uncover the shocking details. Welcome back to 2230, where we bring you the news that matters. If you haven't already, hit that like button, subscribe, and turn on the notification bell so you never miss an update. And we want to hear from you. Do you think Singapore's healthcare system is pushing workers to the brink? Drop your thoughts in the comments below. On January 26th, Red Dot United Secretary-General Ravi Philomen shared on Facebook that he had been informed of a deeply troubling case. A resident told him about a 34-year-old healthcare worker at Tan Tock Seng Hospital who had collapsed from exhaustion while on duty in the operating theater. She was granted 3 days of medical leave, but when she reportedly requested an extension due to persistent illness, it was denied. Shortly after returning to work, she passed away. Philomen's post sparked widespread concern as he highlighted how this case represents a much larger issue in Singapore's healthcare sector: excessive workloads, burnout, and the high-pressure environment many healthcare workers endure. Following these revelations, Philomen reached out to TTSH on January 13 to verify the claims. The hospital's CEO assured him that the matter would be investigated. 9 days later, TTSH responded, confirming that the worker had indeed collapsed on duty, had received treatment, and was given medical leave. However, they disputed certain details, though they did not specify which parts were inaccurate. Then, on January 31st, TTSH took to Facebook, accusing Philomen of misrepresenting the case and publicizing the issue without the family's permission. Philomen fired back, saying that while TTSH confirmed key aspects of his post, they failed to clarify what details were incorrect. More importantly, they did not address the crucial question: was the worker's request for extended medical leave denied? The debate over the facts rages on, but what's undeniable is that this incident has reignited concerns about Singapore's healthcare system. And it's not just one isolated case. After the online citizen shared the news, former TTSH employees came forward with shocking allegations about the hospital's work culture. One described management as one-track-minded, stubborn, and arrogant, rejecting new ideas and treating employees with little empathy. Another compared the hospital to a communist work environment where speaking up was punished. Others detailed horrific working conditions, from being forced to work through sick leave to reporting workplace abuse, only for HR to take no action. And it's not just TTSH. Across Singapore's healthcare industry, many workers are struggling. Nurses are leaving for better work-life balance overseas. Some claim they're micromanaged to the extent that even their medical certificates must include a diagnosis. Others say they're forced to work extra hours, and refusing means being labeled as uncooperative. The mental and emotional toll is immense, and yet many feel unappreciated and unheard. With more testimonies surfacing and no concrete solutions in sight, this tragic death has become a wake-up call for urgent reform. Philomen is now calling on the Ministry of Health to review staff workloads, create anonymous reporting channels, and expand mental health support for healthcare workers. But will anything change? That's the real question. Should Singapore's healthcare workers be given better protections, or is the industry simply too demanding to avoid burnout? Let us know what you think in the comments. And if you found this report valuable, don't forget to like, share, and subscribe. We'll be following this story closely, so stay tuned to 2230 for more updates.